Good evening, everyone. My name is Paul Young. I'm just going to walk you through revenue and spending from a federal level down to a provincial level for Canada. Now, my perspective is only one perspective. I encourage people to go out to government think tanks like C.D. Howe Institute, Fraser Institute, or even bank sites like Scotiabank or RBC. Now, here's a little bit bio by me. I'm a professional accountant by trade, but I'm really about solutions and getting information out. Now, the idea what I want to do is to show you the bucket of revenue that comes at a federal level, how it's redistributed down to the province levels, and what decisions are made by provinces. Now, this presentation, what I want to get you to glean out of here quickly, is that the federal government has decided through the period of slow economic growth in Canada to add $112 billion more into the economy, to circulate it, to better support economic measures to help the economy along. It will only add about a half a point to GDP, so it's not significantly improvements, especially when you have systemic issues on GDP in terms of what will grow, because we're not able to expand exports without adding that capacity, and that's not something that's been discussed. Also, if we want to move people around, we have to make sure that we have profitable transit lines. So there has to be the right balance of policy, and that's what I'm trying to illustrate here as well. Now, I brought the provinces in because they're significant players in this. They receive money from the federal government. That's how we redistribute wealth. And that's where the equalization payments come in, social transfer, the health transfer, and gas tax and infrastructure money. That being said, the provinces themselves have their own revenue sources too as well. Now, pulling back the peel to get to the banana, we should look at some facts here that are not discussed. Ontario, for example, is holding 1% growth to transfers to the hospital. Now, that forces hospitals to deal with a funding cut. That funding cut can drive cuts. In particular case, we've seen cuts in Windsor, Grand River in terms of nursing jobs. That's frontline services eliminated. Manitoba I brought in because Manitoba is going through an election right now. They're constantly getting a D rating in terms of their healthcare delivery. That's something to bear in mind. Yet it has more funding than it ever has. Public sector pay is roughly about 10% above the private sector. We're hitting a period of time, is it sustainable anymore? We've seen issues across the world where governments are using debt to finance their operational expenses. That's not sustainable. That adds to the net debt and then causes future problems down the road. Austerity measures themselves can lead to cuts. We see new programs or programs reviewed that keep the cap of costs, but they're not benefiting in terms of the improvements of the outcome. I got autism listed there. The federal government can make decisions. Every federal government does this. In this particular case, the latest federal government is delaying $4 billion in defense spending to future periods. Problem is we have NATO commitments, we have anti-terrorist measures that we have to do, and we have other things to support the overall safety, public safety in Canada that need to make sure that we align our equipment and resources to meet that objective. New Brunswick's listed there. Quickly, why? Because they're showing you they're doing austerity measures by limiting 1,300 jobs. I listed Nova Scotia. Nova Scotia decided to go after the film and arts industry by reducing the credit. Do we know that they did enough an assessment of that program to see if there was value to it? No, but it does bring in the differ is it's adding $180 million to GDP. So what programs did they save or fund to replace these programs that were helping the GDP? I brought in Quebec because the daycare model is always constantly talked about in Quebec, and yet it's seen increased funding through transfers from equalization up to the normal Canadian social transfers as well as other money, and yet they're cutting $120 million of daycare spaces. So the reason why I frame it here, people, is get away from all the rhetoric from mainstream media and actually do yourself a favor. Go read some of the budget analysis done by different government think tanks to give a perspective of what's happening. Go talk to people that are impacted by funding cuts. Go talk to people when they say that this bucket of revenue isn't being distributed properly. Then go look at when you see compensation government 10% above where the private sector is. It's easy to say that the private sector should pay more, but the private sector works in a market-based economy. Government does not. Government doesn't work based on market. What government does is because it doesn't offer services that it competes in the marketplace. That's not even discussed. So the reason why I want to pose these videos out there, people need to ask hard questions of what's going on in their provinces based on austerity measures or based on poor delivery of program spending. That's something that needs to be discussed. We also are hitting a period of time where we're seeing increasing debt levels by provinces. And that debt is a serious issue. Just like if you looked at your house, you know, when you got credit card debt, at some point you have to pay the piper. And if you've got credit card debt, you have to pay that down. That means certain things have to be cut. Well, governments are the same way. The reason why I want to pose this stuff is it's very critical for people to have discussions with their politicians that ask for more accountability and more transparency how money is being spent. Also to ensure that you're getting value for your dollar. Thank you.